an average 4-year-old. He loves cars, watching his favorite preschooler shows, and laughing and playing with his family. But Nathan is not the average 4-year-old. He was born 3 months early and weighed only 5 pounds. You see, Nathan has cystic fibrosis, which caused a blockage in his small intestine. Because of this blockage, he stopped processing his mother's amniotic fluid. His mother's belly grew to be as big as if she were pregnant with twins, which caused her to go into early labor. Then, 5 days after being born, Nathan had to have an emergency surgery to remove the portions of his small intestine that had become necrotic. This surgery saved his life, but left him with short bowel syndrome, meaning he was left with less than 50% of his small intestine. Nathan slowly began to thrive. At 3 months old, he also had a Nissen fundoplication performed to curb the intense acid reflux he was having. In the 3 months following the Nissen surgery, Nathan showed huge signs of improvement. In that time, his oxygen stats improved so much that he was taken off of oxygen. After 6 months in the hospital, Nathan was finally ready to come home. Luckily, Nathan qualified at birth for Medicaid. Medicaid picked up a large portion of the $1.2 million medical bill. The hospital processed the rest under a program that ensures that families aren't going home in massive debt. Nathan's parents needed to only pay a small portion of the medical bills. As with his hospital bills, all of his feeding supplies, medications, medication delivery devices, and treatment equipment are covered by Medicaid. You might wonder why Medicaid would cover these things when Nathan is at home. For that, we can thank the family of Katie Beckett and President Ronald Reagan. Shortly after her birth, Katie contracted viral encephalitis, which caused a coma and left her with severe breathing problems. She then required the use of a respirator 12 hours a day. With the family insurance depleted, the case fell to Medicaid, the federal state program that helps pay for health care for disabled and low-income families with children. The doctor said she could leave the hospital with proper support at home, but Medicaid refused to pay. At the time, Medicaid policy required a hospital stay for coverage of a respirator, even though the device could be used at home. Iowa Representative Tom Tauck turned a spotlight on the family's problems, eventually garnering the support of Senators Chuck Grassley and Tom Harkin, President Ronald Reagan, and Vice President George H.W. Bush. Katie finally made it home on December 19, 1981, but only after Medicaid was pushed to adopt an exception to their home care policy. Today, this monumental legislation is still referred to as the Katie Beckett Law, and now over 1 million individuals who would be living in hospitals or care centers are cared for at home and in their communities. Katie passed away on May 18, 2012 at the age of 34 due to complications of her disabilities. Her legacy lives on, though. How does this relate? Well, along with the staff of Barbara Bush Children's Hospital at Maine Medical Center, the staff at Children's Hospital at Dartmouth, Katie is helping to improve the lives of children like Nathan. How? By allowing them to be cared for at home. To demonstrate how this saves Medicaid money, we'll take a look at the cost of Nathan's care for 1 month. Then we'll look at the cost for one-time and infrequently purchased equipment and factor both together for an estimate of what Nathan's care has approximately cost since he came home. With each feeding, Nathan takes Creon, an enzyme replacement medication. With his morning feeding, he also gets 1 packet of Nexium that is dissolved into his food. Nathan gets Peptamen Jr. 1-cal formula with each of his 7 feedings. The Peptamen is dispensed from an administration set, which is changed daily. Twice a day, Nathan takes Preventol HFA, an albuterol inhaler, and Flovent HFA, an anti-inflammatory. And once a day, he also has a nebulizer treatment of Pulmozyme, a medication used to help thin the mucus of cystic fibrosis patients. In order to keep his gastronomy tube, or G-tube, sanitary, his parents change the extension once weekly. They keep IV sponges around the G-tube to help keep the site clean. They also use medical tape to secure the IV sponge. His parents also use the tape and a safety pin to prevent Nathan from pulling his G-tube out. Lastly, there are catheter or irrigation syringes, which are used for venting the G-tube. Next, let's look at the cost of one-time and infrequently purchased items. For Nathan's feedings, he uses an automated pump and it is attached to a collapsible IV pole. Every 90 days, his parents change his G-tube, which is called a Mickey, the nebulizer used for his daily treatments, the nebulizer chamber, and mask. The chamber and mask are replaced every 6 months. Then for Nathan's inhaler medications, he requires a non-static holding chamber. The last item is the Vest airway clearance system. The Vest is a chest percussion therapy machine that thumps Nathan's chest and back by varying the flow of air through a vest. The machine loosens and thins mucus in the lungs, making it easier to cough up and spit out. In the 40 months he's been home, Nathan's home care has cost $152,280. Include $21,624 for equipment, and you get a grand total of $173,904. While $174,000 may look like a lot of money, it is almost $1 million less than Nathan's 6-month hospital stay. To Nathan, who has thrived beyond all expectations at home, it is priceless. And this is all thanks to Katie Beckett, her family, and a working Medicaid program.